Well, good afternoon, and welcome to Allergen and Discover Link's webinar today. We are very, very much looking forward to sharing our knowledge with you folks, and want to welcome you and thank you for taking time to be part of our community today. Today's webinar is called Current Allergy Training Laws in the U.S. for Food Service. Maybe because a shorter title was already taken, but what that really does is explain what we're dealing with, what we're looking at across the country, and what we're looking to share with you folks here today. So we'll go ahead and get started. Since I remember how to work the controls here. There's a disclaimer up on your screen. I encourage you to read through the disclaimer while I tell you just a moment about me, your presenter today. My name is Betsy Craig. I started a company many years ago, 2010, 8 years ago now, called MenuTrinfo, stands for Menu Nutrition Information. Out of that, we developed Allergen and Kitchens with Confidence. We are one of the sponsors of the webinar today under the Allergen title, but I get the wonderful pleasure and honor to speak with you and share with you food allergy laws happening across the country today. And at this point, I apologize for the background noise. I'm going to go ahead and ask our co-sponsor, Cindy, if you can make sure your phone is muted, that would be greatly appreciated. Thanks, folks. Cindy, if you would like to introduce yourself and tell folks a little bit about Discover Link, since you're a sponsor, I really want you to jump in here.
All right. Thank you, Betsy. Thank you so much for having me on the call today. Really appreciate that. So Discover Link is a partner of MenuTrinfo, and we do e-learning for the restaurant industry, and our partnership with MenuTrinfo allows us to provide to you Allergen and Allergen Lite on our learning management systems. And we actually have two different learning management system options to choose from. One is called Discover Link Talent, and it's really built for medium to large chain restaurants. And we've been in business for about 15 years, and restaurants have been our business that entire time. That's our focus. So this product has been built from the ground up to serve restaurant chains. So it's an enterprise solution. You can customize the look and feel, and it has a lot of phenomenal advanced features that were designed specifically for restaurants. And of course, we have a world-class support team to help you out as well. For smaller businesses, independent operators, and small chains, we also have a product called Discover Link Learning. And this is more of a self-service model where you can go online and put your credit card in and get up and running same day. There are 3 different subscription levels available, and you can also add content, choosing from Allergen and Allergen Lite, of course, but also any of the other content packages that Discover Link offers, which are all restaurant-specific courses.
Something's wrong with the airplane, so we've got to try to get that figured out. I mean, not like we can't fly it. It's
right.
The air traffic control can't see us. So
air traffic control can't see us. That's scary. All right. Cindy, sorry about that.
That's okay.
I wish the phone worked better there.
That's okay. I'm just about done. So it really provides you an ability to get started with e-learning with a very low cost of entry. But again, either of these options, we can provide Allergen or Allergen Lite for you, and really look forward to learning more about the allergy laws from Betsy. Thank you.
Awesome, Cindy. Thank you so much.
The conference has been muted.
Welcome to Discover Link, and welcome to Cindy. We certainly are grateful to be a partner with Discover Link on this webinar. Will it let you advance the slides? It will not let me advance the slides. So while I'm having trouble advancing the slides, just to keep in mind, we are on technology. If for some reason technology goes offline for any reason, do not worry. Just go ahead and know you can. Here we go. So Allergen is the other sponsor. Allergen and Allergen Lite are, as well as Allergen U, are ANSI accredited training classes. We deliver them multiple ways. And we deliver them through external LMSs, just like Discover Link. Love their partnership and being able to help folks with that. We do internal LMSs. We have many customers where we take our scoring package and put it on your system. We do a live taught version, and then we do a webinar-driven version of our Allertrain classes. Allertrain Lite's 24 minutes, Allertrain's 46. We do believe that we are the #1 leading food allergy and gluten-free training in the country. So enough for, somebody's having trouble with the access code. We do have somebody here to help you with that. Let's jump into what we're doing here today. And first, I need to give you, oh my gosh, we're seeing laws popping up all over. Many years ago, nobody was demanding allergy training in any way, shape, or form, and that has certainly changed. My plan today is to go through the laws by state, but first let's just look at why this is happening. And just in a nutshell, and some of these statistics come straight from FAIR, the Food Allergy Research and Education group in the country. They're wonderful, and I'll get to them in 2 more slides, but they present these stats, and so therefore I know they're accurate. 15 million people in our country currently have food allergies. 3 million people have celiac disease, and just under 10%, 7.5% of the population have an intolerance. And so therefore, we've got quite a few folks that are walking in and asking for a special dietary need at your location for various reasons, everything from a food allergy to an intolerance. And when we look at food allergies with kids, 1 in 13 kids has a food allergy. So that's approximately 16 million children. And what's amazing is that those kids, if you add those numbers up, that's 2 in every classroom. So when we start talking about food allergies, you can see the impact. Take Allertrain if you want to know why, or if you want more information. We have all that handled in our class information, but this is just to present you with a little bit of an overview. And by the way, just so you know, we will be taking questions at the end. You can type them in at any time, and I have someone here who will scribe the question, and we will address the questions towards the end of the webinar today. So Food Allergy Research and Education, FAIR, you can see their URL up there, foodallergy.org. They are awesome. They are the 501c3 in the country that handles food allergies. They are what became the combination of FAIR and FAI years ago, merged together, got married, and now they're called FAIR. We've been a partner with FAIR since 2014. Very, very happy about that. I love the partnership with FAIR, and they do a whole bunch from training to patient education to great resources. I put this slide up there because it shows our name, of course, but also if you see it says free FAIR educational resources. There's lots of tools on the FAIR website that you as restaurateurs can just go use. So why not jump on their website and get the tools you can use right away. When we talk about allergens in the country, I have to always mention what the big 8 here are in the U.S. You can see them in front of you. Many of you can recite them to me. However, it never hurts to touch base and make sure the level set is for everybody, and that is peanut, tree nut, milk, and egg, wheat, soy, fish, and shellfish. And those are the big 8 allergens here in the United States. However, we get visitors from all over the world that visit the United States. One of our big clients is has people coming from all over the country, staying at their properties and eating at their restaurants. So we have to look also just a little bit bigger and look worldwide. So worldwide, we have 21 countries that name allergens, a total of 23 different allergens. So if somebody's coming down from Canada into the U.S., they're looking in your restaurant and want your restaurant to provide information on maybe the allergens they're used to. Canada has 11, as you can see, and not all of them are the same as the U.S. This is being very, it's getting to be more and more of a challenge as we have people coming into the country from different areas, and communication is a bigger and bigger problem. So when we talk about why food allergy training is getting mandated, we can see it. We can see it here in the number of allergens. We can also see it here on an incident that happened in January, and I don't by any means want to pick on this particular brand or any one brand over another, because it could be anybody. And actually, in this case, it was a grilled cheese sandwich that had peanut butter added to it instead of omitted and never anywhere around it. And so when the lawsuits happen, what happens is it becomes CNN, Fox News, Reuters picks it up, or Reuters picks it up. It becomes bigger than ever imagined. And when we're dealing with small children having a peanut allergy and saying no peanuts, my daughter's allergic to peanuts, no peanuts, I don't want to talk about whether it was communicated properly or not. I don't know the situation. What I do know is something happened in January of 2016 where this child had a sandwich, and now it's still like held up in court. And in July of 2017, they said it was going for jury trial, and it hasn't happened yet. So that is one challenge with food allergy folks coming into your restaurant. Another challenge is this. I don't know if anybody on the call has seen this wonderful little machine here. My goal is to educate and inform, and this little triangular bad boy is called a Nima. This wonderful little Nima takes a simple cartridge, and anybody sitting at the table in your restaurant can grab a pea-sized piece of food, stick that food in a cartridge, put the cartridge in the machine, and click go, and smiley face, no gluten, frown face, gluten. And we're seeing a lot of this here on the Menu Trinfo side of our house because folks are coming wanting their gluten-free menus to be verified. Recently, I shared this at a function I was at speaking, and somebody pointed out that the cartridges are like $4 to $7 each, and what patrons would pay that. I simply made note of how many Teslas I had seen on the road and realized that people are going to buy those cartridges, and then they're going to tweet about it, and then it's going to hit press. And this is the thing to work on avoiding, and training is helpful for that. My job isn't to scare you the daylights out of you today. My job is to share with you what's out there and what's coming. And before I move on, I do want to let you know, right now the Nima can only test for gluten, but coming very, very soon is a peanut test, which we actually are very much looking forward to. But peanuts are going to be the next particle that the Nima can test for. So before we jump into the training state by state, I always like to inform restaurateurs anytime I get the chance also to say, hey, when are you on notice? So legally, it has been described to me many, many times by different lawyers in the food allergy space, in the food safety space, that a restaurant is technically on notice the moment a customer says I'm allergic to something. Now, they could say that I'm allergic to something to a hostess, to somebody parking a car, to the cashier, to a busboy, to a line cook, to a manager, to an owner. But the moment they say I'm allergic is the moment the entire location is put legally on notice. And this is where doing due diligence like food allergy training helps you. Okay, so let's go ahead, and don't forget, folks, you're welcome to ask questions. I see a few coming in. If any questions come up, jump in there and ask a question, and we will answer those at the end. So first, let's take a look state by state. And I did this chronologically, trying to wrap my arms around something that keeps getting bigger and bigger. This is a lot like what menu labeling went through in the early 2000s and has grown to be this patchwork of laws and legalese in different parts of the country. Okay, so Massachusetts. This is ground zero for food allergy training mandates. Berkshire is one of the companies. There's 3 companies that has the the restaurant managers must do an online video, and Berkshire is one of the places you can get it. The second piece of the Food Allergy Act back in 2009 is disclaimer language posted, and you can see a little snippet of it there. And the third thing is that there be a poster displayed, and this, not just any poster, but this specific poster that you're seeing right here. So this is the one that's mandated to be displayed and showed. That's Massachusetts. 2010, not long after Massachusetts, we had a mandate come through in Minnesota, specifically the city of St. Paul, and only St. Paul. We have a really great food allergy advocate up there, and that's what pushed this through. Most of these laws come about from good advocates. In Massachusetts, it was Ming Tsai, Chef Ming Tsai, and he was a huge advocate with others in the state pushing for food allergy mandates to begin with in that area. Now in Minnesota and St. Paul, they required this mandate, they mandated this poster be displayed in the kitchen or break room. And so this is what the poster looks like. What's nice up in Minnesota is they gave a little incentive in St. Paul. They said, we'll give you a 7% discount on licensing fees if you go ahead and do food allergy training. But they don't mandate a specific food allergy training required, which is kind of interesting. So next we have New York City and Westchester County, New York. Both require this poster in English and Spanish, both, to be posted in their facility. And I see these all the time walking around New York City. It might be because I'm looking for them, but I do see them quite a bit. So in New York, that's the only food allergy piece that's mandated there right now. It's not the whole state. It's just the city and Westchester County, although there is something pending right now in New York State, but it has not come to pass. I might speak of things that are pending, but I will tell you what's actually there, so you know what's truly in different parts. So Rhode Island, I always say, is sort of monkey see, monkey do. They did exactly what Massachusetts did. Back in 2012, they passed a mandate that said, you've got to watch that same video, that we want the disclaimer language posted, just like Massachusetts, and that we want a poster displayed. And here's a new poster you can take a look at here. This is the one that is required in Rhode Island. And most of these are available from the websites of the health departments of these individual states. So you go on the Rhode Island State Health Department, you click, you Google search on there for food allergy poster, and up comes this. A lot of times you can go ahead and get the PDF version, and then you can print off the poster. Just like foodallergy.org, you can go print off the poster that Menu Trinfo and Allertrain did with FAIR. There's copies of that as a PDF downloadable there as well. Next, we have, sorry about that, I skipped Michigan. We don't want to skip Michigan. Michigan is the first place that started talking ANSI. Okay, so Michigan did a public act back in 2014, and it was in the works for over 4 years. And the act they did required posters and disclaimers. So posters on the wall, disclaimers on the menu. Much like we started with the disclaimer that I'm not a lawyer and I don't pretend to be one. The disclaimer Michigan wants is where all 8 allergens are present, that you declare that on your menus. Also in Michigan, a manager at all times in a state-approved training. So what Michigan did statewide was dictate which training they would approve and which they wouldn't. They did use ANSI, American National Standards Institute, sort of as a guide, but not totally, because there are programs on their list of approved vendors that are not ANSI, and then there's one that just became ANSI back last month. And so that was not necessarily the yardstick they used. They had a list of criteria that's mandated to be approved in the state of Michigan. Another kind of funky thing happened in Michigan. Number one, they have exceptions. So if you have a food safety manager on staff, that would accept you out of requiring additional allergy training. The other thing is they have this super secret special list. Now, it's not super secret. It's actually on their website. You can go get it. If I got it, you can get it. And it lists a whole bunch of brands that went to the Department of Health. I think it's Department of Agriculture is where the health department falls under. But they went to the powers that be in Michigan and said, we want to be accepted out of requiring allergy training. And for whatever reason, these folks were accepted out. It's a great conversation to have with the powers that be in the state of Michigan. If you need help on finding those powers that be, reach out to me afterwards. I will be glad to share my contacts with you. They're great, great folks up there. They've been through a lot with the water, but they are really, really good folks. So feel free to reach out to them. Next, I'm going to move on to Virginia. And Virginia is interesting because Virginia did this really, as Virginia was going to the food code and updating to the 2013 food code, what was happening at the same time is they were getting ready to update to the 2013 food code in 2015, late 2015, they turned around and said, okay, we've got this mandate to mandate training standards that addresses food allergy awareness. But in Virginia, the way the language is written, the mandate is up to the discretion of the head of the health department. So I believe it's a woman there. She's dictating what mandated training standards are. And in Virginia, they've got tons of great information on the website. They provide posters. We've provided a bunch of posters with them. But they really rely on the restaurateurs to get educated off of the website information, and they haven't mandated training yet. Although we certainly have trained a number of state officials, and I remember it was December 1st, almost 2 years ago, actually teaching the class. And so we've had a lot of folks from Virginia come through Allergen, but they do not mandate a specific training class there in the state of Virginia. So let's get a little more current, because there's some things that have happened recently which kind of have put shockwaves through our industry. Number one, in Maryland, we had a food allergy parent who approached a council member in her county and asked to mandate food allergy training. And what's interesting is it went through, and it went through very, very quickly. A bunch of years ago, back in 2014, 2013, they tried to mandate training and posters and all that throughout the state. All they got through was the poster, as you see here. So now, in February of 2016, they went and tried to, I'm getting confused. No, okay, 2017. It's very confusing. I apologize. I had to sneak a peek at my notes. In February 2017, they went ahead and passed Council Bill 33-16 in Montgomery County, Maryland, that mandates that one person at all times any restaurant is open be trained in an allergy training program that is ANSI accredited training. And it is effective as of this past summer, July 1st. However, the enforcement doesn't happen until January. Let me tell you the difference. Effective is when the law takes place, so it is mandated as of that date. But from July 1st until January 1st, the county takes a stance of we're going to let people know they need to get on board. We're not going to smack people real hard. And much like a lot of laws in our space, they like to give people a little room to breathe and sort of drink the allergen-free Kool-Aid and get on board. So that's what we've been experiencing there in Montgomery County. A lot of you folks are on this call because you have restaurants that are placed in Montgomery County, Maryland. If not Montgomery County, Maryland, maybe possibly the state of Illinois. And in the state of Illinois, we just had it go through where they are mandating House Bill 2510. As of January 1st, 2018, all restaurant managers in the state are required to have ANSI accredited allergy training. And like I was saying, we've been ANSI since 2014. Our biggest partner / competitor in the space just got ANSI accredited on September 8th of 2017. So they're now ANSI accredited. And with the state of Illinois, we are looking at January 1st effective, giving a 6-month grace period of enforcement of July 1st. However, many, many folks I've spoken with say, you know what, that's all fine and dandy that they're saying that, but if our health inspector thinks it's the first of the year, it better be done. Otherwise, we're going to get a ping. So that is what has caused the biggest ripple most recently. What's nice is that none of these training requirements have a specific about how it has to be delivered. So it can be delivered any way you want it, which is really helpful, especially trying to get a lot of training out to a lot of people quickly before the first of the year. being able to have systems like Discover Link with their LMS, or having master trainers as part of your brand, or doing live webinars as a solution to get it done in a day is super, super helpful. So any way you want the training will matter and can be done as long as whatever training you pick comes in a variety of ways. If the training you pick to do with your brand is a one-size-fits-all 90-minute course and can only be done on a laptop computer, then you're going to get limited. If you've got something that can live on an iPad or a Surface or be done in the front of the room, somebody speaking multiple languages to break down those barriers, then that's the benefit. So that brings me to the end of my presentation. I will take questions here in just one moment. Before I do so, I just want to give half a plug for Allertrain and let you know, we are super happy to answer your questions. I'm happy to take questions. We'll take questions now. You can shoot questions to me later. If you need links to find posters or people to reach out to, absolutely not a problem. And we have this wonderful email set up for you folks, and that's info@menutrinfo.com. We can answer that. And a lot of you came onto our webinar either through our newsletter or somebody emailed you or forwarded you the newsletter. So you might just want to go ahead and text Menutrinfo, our company name, to the number you see there, and you'll join our mailing list. And we'll make sure to keep our newsletters up. So I'm going to take the first question. Will the Allertrain Lite suffice for this certification? And I took yours first because I know you. So yes, it will. Allertrain Lite will suffice for Illinois and will suffice for Montgomery County, Maryland, on both of those. In Michigan, you have to do the straight Allertrain or Allertrain U, which is our college and university program. So the next question, will the slides be distributed? No, they won't. If all went well and I didn't totally mess up, then we have this as a recording, and this will be on YouTube. What do I think about Sesame being added to the top 8? I have been told that to get those 8 changed in any way, shape, or form will be an act of Congress. Right now, D.C. seems to be a little busy. So I don't know if that's going to happen anytime soon. I did ask the USDA myself that specific question about 9 weeks ago when I was in D.C., and they said I shouldn't hold my breath in this administration to get it moved. Sesame and corn are the next 2 big allergens we see here in the United States, and the ones that we label the most for menu labeling. Are pink peppercorns a concern as part of the cashew family? That's a huge debate question. I'm not going to step in that one except find out who asked me, so I can email you separately offline and have that conversation. Can you explain more about the company is legally on notice when allergy is mentioned to the restaurant? Yeah, that always scares people. But the truth is, if somebody walks into a restaurant, somebody could even, it doesn't even matter what the restaurant is. The hostess, I have an allergy to onions. I'd like a table for 2. At that moment, the entire restaurant is put on notice that that person has an allergy to onions. So if, God forbid, anything happens where they have an allergic reaction and onions were involved, the restaurant's going to have a lot harder time saying they didn't know, which is why we always teach in Allertrain, and everybody on this call should be through Allertrain at least once, because some of the basics are there, but every restaurant should have disclaimer language and information available to all of the patrons. Can you explain ANSI? ANSI stands for American National Standards Institute. I will tell you that it's a nightmare to go through. Had I known what it was going to be, I probably wouldn't have thought I could do it, but I did it. It takes anywhere from 3 months to 9 months to go through it. It took me a 2-day class to prepare to even apply. And they make sure that the piece of paper that prints my certificate to you on it has merit, that the financial backing of our company is solvent and decent, and that we are a reputable business, so that you're just not getting a piece of paper from anybody's printer. So there's a lot of pride to have ANSI, but it's a lot of hard work to get it, and it's a yearly nightmare 100-page submission to keep it going. do you see anything similar to Illinois or California anytime soon? I'll tell you what, we're definitely seeing it in California. I'm seeing it in Connecticut. I'm seeing it. I've saw it push back in Texas. I'm definitely seeing it in New York State. And I can't believe it. We're in Colorado, which is like Wild Wild West state, but I hear it's coming here. So the final question I'm going to take, because we're going to be out of time, I apologize about that. I will stop the recording, and if anybody wants to stick around, I'll answer some more questions. But I wanted to keep this to 30 minutes and respect your time. Will the ANSI manager, ServSafe manager certification be sufficient proof for that state's requirement to be met? Only in the state of Michigan. An ANSI ServSafe manager or NEHA manager or any of those managers in Illinois is not enough. It won't do it. And if you ask the folks over at ServSafe, they would flat out tell you that it's totally different. Food safety, time and temperature, I can cook out the pathogen. Food allergy, I can never cook it out. And so therefore the teaching is different. And I do know that in ServSafe and programs like that, there's 2 to 3 pages about food allergies. But this has become such a public health crisis. It has required a separate training, very, very much like alcohol. Very much like, we send people to TIPS as alcohol training. Well, we're sending people to Allertrain for allergy training, allergy and gluten-free training. Just a little plug, we're the only one out there that has a whole gluten-free component to our class as well. So at this time, I'm going to go ahead and stop the recording and thank people for attending.